Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about stroke. Stroke, as you know, is a very common problem. In this country, 795,000 people every year have a stroke. Worldwide, 12.5, altogether 15 million plus people have a stroke every year. 12.5 million of them is because of hypertension. And I have discussed over the last many weeks that I've been doing this series on stroke, all aspects of stroke. I discussed the different types of stroke. In this segment, however, I'm going to take my time to really talk about a very common type of stroke that you probably heard about, but you never know what the explanation is for. Something called transient ischemic attack. Extremely common. 50% of individuals who are suffering from transient ischemic attack is at risk of developing a full-blown ischemic stroke. It's very common. And TIA, we call it itself, is very disturbing. Very disturbing. What it is that people would sit there minding their own business, and all of a sudden they have the symptom, they feel weak, they're blacked out. And they can black out for a few seconds and come right through, or they can black out, as it were, for a minute or two, or sometimes they can black out for several hours. And then the post blackout syndrome can last for a few minutes, a few hours, and sometimes a few days. And sometimes the patient can in fact develop acute weakness in the limb. Sometimes they can transiently become dysarthric, that is to say they're not speaking properly, and then it comes back. So there's a clinical diagnosis that has to be made by the physician that's caring for the patient, whatever this is all about, because there are a lot of other things that can cause, quote, syncope. And it's hard to differentiate between syncope versus a TIA. Very problem, very difficult. But TIA is extremely common. And it occurs basically in folks who have hypertension, diabetes, high cholesterol, those all three. What's causing this? Okay, well, the basic problem is that deep inside the substance of the brain, all of us, of course, have small arterioles that carrying blood and oxygen to perfuse that part of the brain. What's going on is that this individual, for either because they have hypertension, diabetes, high cholesterol, a combination of those three things, develop what's called microvascular disease of the brain. That is, they have multiple little infarct, they call them, that can be seen, of course, on MRI, MRAs, and they have those little tiny stroke, and they are permanent. That's right. They don't go away because of the effect of the blood pressure, the diabetes or the hypertension, hypertension, diabetes or cholesterol, what have you. They develop plaques and these tiny little vessels. And because they develop the plaques inside them, and the plaque doesn't go away, that causing narrowing of these tiny little arterioles that must carry blood and oxygen to that deepest part of the brain. Occasionally, the platelet plug, as all debris are passing through, that's right, passing through, among them, of course, is platelet. The platelets aggregate and they get stuck on the little narrowing when the area is in those vessels narrow, they get stuck there. Once they get stuck there, then that automatically prevents blood and oxygen from going through that part of the brain that they're responsible to perfuse, and the person blacks out. So that's the mechanism that can cause somebody to have a transient ischemic attack. That is why when these people, once the diagnosis is established, then of course you give the patient aspirin to dislodge the platelet plug to allow blood flow to reestablish, and then the person comes through. It depends on the extent of it and how many of those are involved in the process that determines how long it takes for the person to come through and how long it takes for all the post-TIA syndrome to go away. Now, what has to be understood is the fact that the microvascular diseases of the brain also is a very common, in fact, is extremely common in the cause of dementia. 90% of what we call African American, which across the world we call Negroes, or if you want to call them people of color, where they have the higher incidence of blood pressure than anyone else, suffer from microvascular disease of the brain. So the vast majority of people of color who have high incidence of blood pressure that develop dementia is because of microvascular disease of the brain. It's not because of Alzheimer's. There's a huge chapter in this book here, African American Health, on Alzheimer. There's a separate chapter on dementia, because Alzheimer is a form of dementia. So not everybody who have dementia have Alzheimer's. I read somewhere the other day there was a listing of the different ethnic groups that have Alzheimer's. Out of the blue, somebody mentioned black folks as number one in Alzheimer. Completely, totally bogus. Not true. Absolutely not true. Yes, there's 6 million people who have Alzheimer's, but nowhere in the world you could prove to me that most of the people who have Alzheimer's are black. Absolutely false. Most of the people who have dementia can be said. What's the reality is the fact the vast majority of black folks who have dementia have microvascular disease of the brain because of untreated or poorly treated hypertension, untreated or poorly treated diabetes, untreated or poorly treated hypertension, high cholesterol, or a combination of all three. Because it is very frequent. People who have hypertension also have diabetes and high cholesterol. And these folks are not being treated properly, or some of them not being treated at all because of lack of insurance, lack of medical education, that is to know health education, how necessary it is to go to the doctor, and how necessary it is to follow the advices of the doctors, etc. So that is why the minority communities in this country are being wiped out because of medical problem. Being wiped out because of medical problem. And there's not a subgroup of folks who are flat out wealthy. They consider themselves the Hollywood type people. They also, most of them are getting lousy to absolutely poor medical care because they wind up going to the so-called Hollywood type doctors who themselves don't have a clue what they're doing, don't have a clue what they're talking about. And yet these people go to them because that's where the limousine can fit better in the parking lot, etc. I'm serious. Okay? These are people who have millions, and then they're getting terrible medical care because they don't go to the real medical centers where highly qualified, highly competent doctors are stationed that can provide high quality care for them, because they go to the doctors who could prescribe, give them all the pills they want, etc. It's crazy what's going on in the field of medicine, okay? But that's what it is. That's what's going on, okay? So there are rich folks, yes, that are getting high quality care because they go to the big time medical centers where they're getting high quality care because there you have a lot of big time academic physicians whose job it is to provide and teach the highest quality 21st century medical care that exists. That's a different subgroup. But those whose habit is that what they need more is pills and other garbage that are they need to satisfy the drug addiction problem and so on and so forth. They go to the folks that will give them these things, and they ignore the quality medical care, and all of a sudden you hear so-and-so die suddenly and so on. Okay. This is what's going on. I'm not saying anything that is inappropriate. This is what's going on. After all, I read the literature 24/7, and I know what's going on. So, TIA then is extremely, extremely common. And when you have somebody who's having a frequent TIAs, believe it or not, has forced many high quality, highly competent individuals into retirement. because they couldn't continue to do the work they're doing because every a few days or so they wind up having TIA, blah, blah, blah. And when they start happening, there's no telling when, at what moment, when you may be in the middle of something crucial and bingo, you have a TIA. So the most important thing is try to avoid the things that cause the TIA in the first place. Make absolutely sure that you know you have hypertension. Make absolutely sure your hypertension is treated properly. Don't try to question. Try to find the best doctor that you can get your hands on that knows exactly how to treat blood pressure properly, who knows exactly how to treat high cholesterol properly, who knows exactly how to treat diabetes properly. And there are many, hundreds, there are thousands of them around, hundreds of thousands of them around. You just have to know where to find them. And they are here in this country and across the world. Because once you start having TIAs, once you develop those plaques will not go away. Well, so how does the plaque develop? Well, here's the deal. And I said it before and I'll repeat it again. The first step in the process is the fact that the blood pressure inside the vessel is high. The vessel was not created to be able to withstand such a high pressure. Because the pressure inside the vessel it becomes so elevated, the first lining of that vessel, we call the intima, get damaged because of the elevated pressure. Nothing else has to happen. A lot of stuff can happen, but nothing else has to. Just that alone is sufficient to damage the first lining because the pressure is elevated inside it. Once the first damage occurs, the vessel is no longer crystallinely soft. So as the blood is passing through, the bloodstream carries all kind of debris to the liver so that then the liver can process it, send it down back into the bloodstream to the kidney. We could urinate it out or pass it on the stool or so on and so forth, or and exhale it out or whatever. That's the process. Because the smoothness is no longer pristine the way it's supposed to be, it traps the debris that's passing through. That then creates what we call a nidus. The first thing that occurs, the first debris that attaches itself to the area where the smoothness is no longer there, that's been damaged, that forms what's called a nidus. Once one nidus is created, then more debris piled up on top of it, then that creates a local inflammation. You cannot have a substance that doesn't belong inside a vessel, stay inside a vessel without causing a local inflammation to occur inside that vessel. You don't develop plaques of any kind inside your vessel without having the process of inflammation occurring first. Once that happens, then the local inflammatory process begins to damage the vessel. One thing pile up on top of another, the plaque forms. Once the plaque forms, then the vessel becomes narrow. I want you to imagine how narrow an arteriole must be. Very narrow, tiny little thing. That's where the blood has to pass through, not deep inside the brain. We don't have all these big vessels. We have the little arterioles that's perfusing the brain. And if that doesn't happen, then you develop plaques, and the blood cannot go through, oxygen cannot go through, local ischemia develop, and you have chronic ischemic microvascular disease of the brain. You cannot have hypertension. Don't have it treated properly, and don't develop microvascular disease of the brain. And of course, 1 out of every 2 black folks in this country is hypertensive. 1 out of every 2 adults is hypertensive. 1 out of every 3 general adults altogether suffer from hypertension. This is how common that is. Altogether now we have, after the new definition of pressure that came out a year or so ago, more than 100 million, 110 million folks now is classified as being hypertensive. And hypertension doesn't play. It's a serious, serious, serious disease. Okay? Of the 7 billion people in the world, almost 1.5 billion have hypertension. Serious business. So therefore then, that's the process that can cause TIA to occur. But wait, there's more. Okay, now I want you to relax, calm down. You're going to hear stuff that you never heard before. Namely, I just discussed hypertension, diabetes, cholesterol, causing plaque that can ultimately narrow those little vessels. Of course, it narrows the big vessel, but I'm talking about TIA. No one knows about the big vessel than I do. I spoke about that, talking about the TIA, the tiny little vessel. Okay, here we go. There are a series, dozens of chronic autoimmune inflammatory diseases that the human race has to deal with 24/7. All sorts of stuff: lupus, rheumatoid arthritis, systemic sclerosis, dermatomyositis, Sjögren's syndrome, sarcoidosis. I can go on and on. All diseases are inflammatory in nature, all of them. They are autoimmune. You can't have an autoimmune without having an inflammatory stuff attached with it. Myositis. I can go on and on, keep naming them, rattle them from the top of my head to you. All of them are inflammatory in nature. And how about that? Here we go. All chronic inflammatory diseases that can be found in the human body ultimately lead to plaque formation. How about that? Because remember I mentioned before, you have to have an inflammation for the plaque to occur. Well, these diseases, they are located in the human body. Once they are located in the human body, all of them has a systemic component to them. Therefore, the blood carries the chronic inflammatory garbage all day 24/7. And those things, therefore, all inflammatory diseases can cause atherosclerotic plaque to develop. Let me repeat that. All chronic inflammatory diseases, all chronic infectious diseases that's located in the human body predispose the arteries from developing plaque. Because as you have these diseases, they are systemic. The inflammatory or chronic infectious process that are affecting the body must be dislodged. The bloodstream carry them throughout the rest of the body. And as those inflammatory garbage are passing through, what do you think is going to happen? Every now and again and very frequently, inflammatory stuff gets stuck inside those vessels. As they get stuck inside the vessel, what's going to happen? I just told you, plaques is going to develop, because you cannot develop plaques that narrows vessel without an inflammatory process involved in it. This is how plaque forms. There's no other way of forming a plaque. It doesn't matter if it's the cholesterol that's elevated. It doesn't matter if it's the diabetes that's going to damage it. Yes, diabetes does damage plaque. I was telling the student yesterday, how do you go from diabetes to end-stage renal disease? Well, you heard it. When you have diabetes, there happens to be other sugars in the body also elevated when the glucose is elevated. But guess what? Are you ready for this? The glucose is not the most toxic of the sugars. How about that? It is sorbitol. We don't test for sorbitol clinically every day. But those of us who are in the teaching business, we know how bad sorbitol. What do you think damages the eyes more? The sorbitol that's part of the When the sugar goes up, all these other glucose also go up. And the nastiest of them is the sorbitol. And it attaches itself, secret material that damages the vessel, that then ultimately damage the kidney, damage the eye, damage the brain, etc. You never heard these things before. Don't expect me to sit here and apologize for that, okay? Because when folks are sleeping, 2, 3 o'clock in the morning, guess where I am? Reading, writing, and so on and so forth. So don't expect me to apologize for that. Who stopped them from reading? Who stopped them from writing? Nobody. This is a free country. The knowledge the stuff that I'm giving you, I do not have a monopoly to this. I didn't invent this stuff. It's all out there. Yes, there are things that God gives me the gift that I can sit here and figure out, and I do just about every day. That has not even been published yet. But that's okay. That's who I am. I'm not going to apologize for it. Because people have other stuff that I don't have. But God knows what He's doing. He also gives me stuff He hasn't given them and will never give them. That's just the way it is. You go and talk to God about it. So, therefore then, let me give you an example. Sickle cell disease, right? Extremely common, right? Extremely common, right? Very common. More than 100,000 folks in this country have sickle cell anemia. But how do you go from sickle cell anemia to an inflammatory process? Who ever heard such a thing? Sickle cell disease is a very bad hemolytic disease. And here it is, I'm sitting here telling you, you can't have sickle cell disease without having strokes after stroke after stroke after stroke. It isn't just because the cell have a banana shape and it gets stuck inside the vessel. This is part of it. But guess what happened? Can you figure it? Guess what happened when the cell gets stuck inside the vessel? There's a traffic jam because there are other cells that want to pass. Can't pass through because the cell gets stuck inside the vessel. What do you think happened when the cell gets stuck inside the vessel? Guess what happened? The cell to surface of vessel syndrome causes what? Are you ready for this? An inflammation. An inflammation to develop. So therefore, sickle cell disease, which is one of the leading well-known inflammatory diseases in the world, also, hemolytic disease in the world, also happen to be an extremely common inflammatory disease. How about that? Because you cannot have cell that's stuck to inside a vessel for any length of time without the cell damaging the surface of the vessel where it's sticking to. The process of the cell sticking to the vessel right there, that's what's taking place. An inflammation is taking place because the cell had no business being there. That's not what God created that vessel for. So the cell is being read by the surface mechanically by the vessel. It damages it. That's right. And then once that first lining of the vessel is damaged, as it's stuck to it, an inflammation is developing. How about that? Once the inflammation develops, guess what's going to happen? Plaque's going to develop. You can't have, right now, there are evidence that fetus brain that's in the mother's womb already having stroke. You can't make this up. This has been documented through research. If you have sickle cell disease, you're carrying an infant, a fetus, that's going to have SS disease, sickle cell disease, while before the infant is born, even though there's plenty hemoglobin F at that time, and yet it has been documented that that poor fetus is already having inflammatory process in the brain, etc., because the sickle cell is already there. That's right. The baby doesn't have to be born for the sickle cell to start. They started while the fetus is already in the mother's womb. How about that? Okay? So you can't have sickle cell disease, therefore, without having an enlarged heart. You can't have sickle cell disease, therefore, without having multiple stroke throughout life, and so on and so forth. That's why there's so much problem with the skin of individuals with sickle cell disease. They have leg ulcers. Why? Because the stuff gets stuck in the leg, blood cannot grow through, ischemia develop, perfusion cannot occur, you bang the leg a little bit, you develop a little sore, ulcer develop, it gets worse because not enough blood and oxygen is going through there. It's not that difficult to figure these things out, okay? So therefore, getting back to TIA then, it's a clinical diagnosis based on the patient's symptom that you take from the patient. You examine the patient. Then you do your blood test as per usual. You do your EKG to make sure there is no cardiac stuff that's causing the person to be blacking out. You get an echocardiogram, and you proceed to do your CAT scan, which may or may tell you something. Then you go ahead to the same process. You get your MRI done. You also do an MRA that's evaluate the carotid and all this other stuff for you. And then bango, you get yourself a diagnosis. The patient has microvascular disease of the brain. Right away, you know that is why he or she is having TIA. And then when you treat that, therefore, you try to give the patient an aspirin, if that will do it. If that doesn't do it, you try to give the patient Agrenox, because the Agrenox has dipyrimidol on it, which is open the vessel. It also has 25 milligrams of aspirin in each pill that dislodges the platelet, allowing blood to go through. Okay? Now, I didn't even go about telling you the dozens of other material that people carry in the blood we call thrombophilia that can also be causing them to develop the microvascular disease to begin with. A classic example is lipoprotein A. If your lipoprotein A is elevated, which is 20% of the U.S. population, you're going to wind up with microvascular disease of the brain. That's right. It's not just hypertension. It's not just diabetes. It's not just high cholesterol. It's all these other inflammatory processes that I just described to you. I just give you another one. Thrombophilias. The classic example, and there's about a dozen of them that I have discussed on the show, but the classic example is lipoprotein A, 20% of the U.S. population. This is 21st century medicine. You can't have elevated lipoprotein A without subsequently having microvascular disease of the brain, which then can cause TIAs, etc. Next week, I'll continue the discussion about TIA, talking about the thrombophilias. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.